Good afternoon, everyone. I am Moises Agosto, and I'm the Director of Treatment for IMAC, formerly known as the National Minority AIDS Council. And today we are presenting to you our campaign, Vote for Your Future. It has been a campaign that has been going around the country, mostly targeting HBCUs, which are a very important group of young individuals in the African American community. We have been helping them with this campaign. Is an educational one, so the purpose is not to tell you who to vote to. We cannot do that. But our goal is to tell you how to vote, how to go and vote in terms of like being registered, understand and know which school do you have to go, or what is the address of the place closer to you. So we really take this very seriously as we are in some very challenging times, and that voting in this election is voting for our future, for the future of our kids and children and young people, and it's critical that we understand what we need to do and that we go and that we vote. So let's start with the first slide. Next. So as a community, it's important that we educate our constituents, and that when we educate, that want to make sure we state that we're a non-partisan entity, and that we cannot go to one side or the other. We are here just to facilitate the process of voting for you, and that those that are interested in voting, we can help them to go through the process of being registered and also to successfully participate in the 2024 election. Also, we want to encourage voter turnout and engagement among older adults, people of color, people living with HIV, and their allies through social media. And we want to really encourage those that we engage and those we communicate with to activate their networks as well, and to pass along the message of the importance of voting among our HIV peers, but also among our friends and family. We want to make sure, and we do collaborate with other movements, social movements, and health movements related to organizations, so we can enhance our abilities to reach underrepresented population and marginalized community. These be organizations that work with social justice, organizations that specifically deal with one of the communities that we have as our constituents. So collaboration is important, as well as is building the networks and mobilize the community to vote. Next. So what can I tell you about the campaign? As I told you, we started this campaign in November, in early this year, and the aim of the campaign is, as I said it before, to educate the HIV community. That's why we have invited you to be part of this discussion, the HIV 50 plus and long-term survivors communities. We encourage, as I said, we want to make sure that there is a good turnout, and that everybody that has the right to vote, as a way to make our statement as we define the needs of services, the need for treatment for people of color and marginalized communities. IMPACT roles as a national organization is, as I said, not to promote a specific candidate or to promote policies or positions, but it's to educate you. And that's why we have invited you to this discussion. Next. So the key groups that we are working with are people of color. We're emphasizing on the youth age 18 to 35 years old. And also we're working with people living with HIV specifically, and especially those older adults living with HIV. Also, our other key groups are allies, as I mentioned earlier, like other organizations that also work with these communities or work around issues that relate to the needs of these communities. Next. So we need glasses. so, so how can you get involved? So what is important to do first is to verify and make sure that you are registered to vote. Even sometime when we think that we are, or that it automatically happen with some, errand that we run with the Department of Transportation or something like that, it's important that we confirm that. That's why we are providing this email address. It's not an email address. It's a online address where you can go and verify that you're registered. It's called www.vote411.org. Check registration to check your voter registration status, right? You go to that site, you follow the instructions, and you verify that you're registered. This is a very important step. So if you're not registered, the next step is to register. Make sure if you're not registered, you're not going to be able to vote. So register to vote. Check your voter registration deadlines for your state. If each state has different dates, so make sure that you have the right information from the state that you have your residence, that you live, that you're planning to vote. Again, the same website, www.vote411.org/select state. It's very important. So the next step would be to educate yourself on what is on the ballot, right? It's important that we need to understand what are we going to be voting for. We must know what is in our ballots and what is at stake for our community. Not only you may be voting for a candidate for the presidency, but also you may be voting for uh, propositions that are also part of the ballots that can affect your life directly or indirectly, or your community. So make sure that you educate yourself about what is on the ballot, and visit the website that we are presenting here, and look for the sample of ballots and the candidates up for election. Don't wait until the day that you're going to vote to do all of that. Be prepared, and that's why we want to make sure that through this webinar and through our campaign, you are prepared to vote. So also spread the word. Once you are set, make sure that others around you are set too, and share with them what you have learned through us. Remember, check if you register, make sure that you look at the deadlines in your state, right? And also educate yourself about what is in the ballot. What are the things that you're going to vote for, you know, beside just, who will be the president or not. Next. So why do we need get out to vote now? Candidates in in the ballot, that the candidates that you will vote for, they have proposed healthcare plans and budget, and these budgets could dramatically affect the lives of people living with HIV, right? Or at risk for HIV, especially for Americans over 50. as we have all known, we're going to be we are half, and we will be the majority of people living with HIV. And, we come with very specific needs that still have not materialized the services that are going to address those needs. We come with the issue of, you know, comorbidities on top of HIV. So this is the first time the care and the service community have to deal with an HIV population that is getting older beyond 50. So, and each decade is different. So it's important that we look at what is the proposed healthcare plan, what is the proposed budget that the candidate is moving or pushing forward. We need to make sure that it's fair enough and it's sufficient to deal with the expenses needed to reset our healthcare system so it responds to the needs of the HIV person, older adults, and long-term survivors. So it is very important that these specific population, educate themselves and educate others and get to vote. Ending the HIV epidemic initiative, we are working on it, and the plan that we have, has it's a federal initiated plan, as you know, and it was announced in 2019, and the goal was to reduce the number of new infections by 75% by 2025 and at least 90% by 2030. We're not there yet. And we need funding to make sure that our federal HIV programs are equipped to fund community-based organization and end the HIV epidemic. So there is issues related to new infections, and also there are issues about access to treatment that will depend on the funding and the initiative of ending the epidemic to continue to be supported. So voter suppression laws is a threat and have a significant negative impact on people of color, as we are aware of, and it tends to deter many of them from voting. When more barriers are in place, people get disillusioned, people get tired of running into barriers to exercise their right to vote. So we need to be strong and be aware of these voter suppression laws and be persistent about exercising our right, because it's our right. And as some have said, our life will depend on how we vote. Our future will depend on how we vote. This is for people of color, we need us to be mobilized. So as I said, sometimes we get like frustrated, but let's transform that frustration into power to mobilize. Let's get out there, let's talk to our friends, and make sure that these elections would end up in a result that will support and take care of those people living with HIV in a comprehensive and effective way. We must mobilize. I cannot say it enough. So our voices are heard. Next. So please, to learn more about this campaign, you can go to our website, mac.org, get out to vote. Uh, Also, as we mentioned, please, you have the other website that give you information related to what do you need to, as I said, to verify and confirm that you're registered, that if you're not registered, so you register, that you verify the state in which you're registered, and also that you're aware of like what is in the ballot of your state and what are the things that you need to learn and make very a decision about when you vote. Also, AgeUnited.org has an election center that is very useful, and it will also help you to understand and have the information you need to exercise your vote. So that's there is the next one. This is a quote. Join us is a quote, right? Join us in the fight for equity, justice, and progress for all. The future is in your vote. This campaign has been put together by NMAC, the Coalition for Justice Equality Across Movements. So I hope that we inspire you to get out to vote and that you get connected locally to those organizations that can support you. So I guess that we now kind of open if anyone have any questions um, or comment, they're welcome now. All right. If there are not any questions, I know there's other people monitoring the webinar. Uh, we can just finish and just give lead.
We don't have any questions at this time. Sorry about that.
No, it's okay. Thank you. I was waiting to hear
Oh,
if
we
we.
have somebody with their hand raised. Larry Bryant, you just raised your hand with a question. If you wouldn't mind, could you go to the question section? You should see a box with a question mark in it, and you can click inside there and type your question in there, and I can read it out loud. So just give them a few moments, Moises.
Sure.
Okay, so it says Moises, what advice would you give to individuals in places that are, say, less, sorry, what advice would you give to individuals in places that are, let's say, less than supportive about voting?
I think that if we as advocates are familiar or aware about these communities that are less supported, I think that local mobilization, knocking at the door from those of us that are knowledgeable and want to make sure that we can mobilize, we can go to these communities, or we can reach out to organizations in those communities locally that are doing the work. There is a lot of community-based organizations that are now mobilizing. They may not be HIV specific, but they are there for voter registration and things like that. So for those that if you feel also that you're not supported enough, I would recommend that you go to these websites that we offered you, the Voter 411 website. You also can reach out to H United Voting Center, which they have developed a set of resources on how to connect you locally with your community. So I would recommend doing some research, or even calling some people, looking for organizations that can provide that support. Even if it's States United at the national level, or MMAC, or the Voter 411. And if you have any question, don't hesitate to reach out to us. I hope that answered your question, Lottie.
Thank you, Moises. That seems to be the only question that we have
All
right
right.
now. Larry Bryant just gave you a thumbs up for your answer, though, so great.
All right. Okay. Thank you, Taylor. I'm very happy we did this. And again, if you have any questions, please reach out to us. We'll be more than happy to find any support you may need. And with that, good afternoon, and please, please get out to vote. Thank you.